NPTE StudyCast.
Welcome to NPTE StudyCast, looking at central cord syndrome with Bridget Ripa. Bridget, central cord. I'm having a feeling that it has something to do with the cord in the middle.
In the central part. You got it. It's just damage to the central portion of the spinal cord.
Okay. How does that happen? Describe it briefly, or what is it?
Yeah, so it's most commonly seen with hyperextension of the cervical spine. So it can also happen with some sort of inflammation or pressure on the cord centrally, but typically you're going to see it with the hyperextension.
Anatomy.
Now we know the spinal cord is involved, the central portion. What's that going to kind of look like and appear like?
I think these patients are actually really tricky to work with because their upper extremities are weaker than their lower extremities. Unlike a lot of other spinal cord injury patients, the sensation of the sacral region is spared.
Differential diagnosis.
What else could it be? Differential diagnosis, as with all spinal cord injuries. I feel like those are in play.
Yes, any of the syndromes that we've talked about before, but that's where, again, you're going to kind of rely on your clinical presentation and how the patient looks clinically. And then you can also just rely on imaging that's done, so CT or an MRI, to really get that actual differential diagnosis.
Special tests.
Prove it or disprove it, special tests, the imaging that's going to be involved with central cord syndrome.
CT or MRI, and then again, just kind of keeping in mind what some of those clinical presentations are. So the upper extremities being more impaired than the lower extremities, things like that are going to be your clues that you're thinking more along the lines of central cord syndrome.
Treatment examples.
Physical therapists working with patients with central cord syndrome, what are they going to focus on?
You want to make sure that these patients are medically stable first, establishing a bowel and bladder program, and then focusing your treatment on motor learning, task-specific training, neuromuscular re-education and strengthening, weight-bearing, tone management, functional e-stim, aerobic training, positioning, splinting, bracing, locomotion if applicable, and especially in this population, their lower extremities are going to be stronger than their upper extremities, so you probably will be doing some sort of locomotion. Still keeping an eye on shoulder pain, still allowing these patients to compensate. So with some of the other neurological patients, you might want to limit their compensations, but still allowing compensations in this population.
What to know for the test. And the last part, how will it be tested on the NPTE? I'm guessing upper more involved than lower is going to be a common theme.
That's usually they like to give you some sort of hallmark sign as a clue, something like the presentation, and then also the mechanism of injury. So these being more of the hyperextension injury.
Got it. All right, that's central cord for the NPTE.
Great.
NPTE StudyCast. Brewed by the PT Pintcast.